Assalamualaikum warahmatullahi wabarakatuh. I'm Atika Arshad. Would love to share a clinical case study regarding a rare infection caused by S.maltophilia on a patient that admitted in hospital Teluk Intan during my clinical internship period. My objective of study is to understand the underlying question of an organism causing infection to human. Case presentation. A 82-year-old Chinese male patient with a medical history of biopsy for colorectal histopathology examination (HPE) on June. Microscopically, the biopsy showed an infectious colitis. The stool sample was sent to microbiology laboratory for culture and sensitivity tests. It turned out that he was infected with Salmonella species. Well, this patient was admitted with a diagnosis of adhesion colic, acute kidney injury with metabolic acidosis, and urosepsis to rule out rectovesical fistula. For 3 consecutive months, June to September, his laboratory findings showed constant infections through stool and urine cultures, while on October, the patient presented to the patient with no abdominal pain but having persistent temperature spike. FBC test was carried out and showed neutrophilia result. Thus, blood sample was taken for culture in which resulting a positive growth on S.maltophilia after 3 days of incubation in back tag. Okay, so these were lab tests that carried out for this patient include biopsy of colon rectal for HPE, followed by full blood count, culture, urine FME, and biochemistry tests. In this case, the organism species identification was done using culture and Vitek2 systems. Sensitivity testing was done for the S.maltophilia isolate, and the result showed the organism still susceptible towards cotrimazole, levofloxacin, and minocycline. These were parameters in his FBC that has been flagged and critical for patients' health observation. His white blood cell count was flagged as high in range from June until October. Meanwhile, his red blood cell count was low in range and absolute count for neutrophil was high in range. Thus, it indicates that the patient had shown positive sign of infection. As we can see that his samples that sent to microbe lab were all positive with organism growth. In June, stool sample was positive for Salmonella, followed with mixed growth in urine, and lastly was S.maltophilia in his blood. Okay, next, these were the abnormal parameters recorded for urine FME and biochemistry tests. Okay, let's discuss. Stenotrophomonas was formerly known as Pseudomonas or Xanthomonas maltophilia, is an emerging as an opportunistic nosocomial pathogen that primarily affects immunocompromised patients. Well, this organism is a gram-negative bacterium in rod shape and an obligate aerobe bacterium that able to survive in poor nutrient condition. This bacterium can be recovered from moist soils, vegetables, and even in medical devices such as catheter and nasal bronch. S.maltophilia is tends to infect elderly since they have weaker immune system and diagnosed with immunocompromised diseases such as diabetes mellitus. Infection with this bacterium can cause bacteremia and other serious infections. Treatment of infection with this organism is also complicated by the fact that isolates are frequently resistant to many of the currently available broad-spectrum antibiotics. So, S.maltophilia also has a significant feature as its ability to form biofilms on surfaces, including glass, plastic, and host tissues. The route of administration for the organism to penetrate human body system is through an active site of infection with bacteremia. An infection was considered to be catheter related if there was inflammation at the catheter insertion site or if a culture of a catheter segment was positive for S.maltophilia. In addition, underlying serious illness including cardiac disease, pulmonary disease, hepatic disease, and renal disease was relatively frequent, causing an individual is susceptible to S.maltophilia infection. The laboratory findings showed that the patient had demonstrated several signs of hepatic damage based on his elevated alkaline phosphatase reading, presence of bilirubin in urine FME, and low of albumin. Apart from hepatic damage, he was diagnosed with multiple illnesses that were potential to weaken his immune system much more. In addition, high creatinine in his renal profile indicates kidney malfunction as he was diagnosed with acute kidney injury. In this case, prior S.maltophilia infection, the patient had undergone a surgery for rectovesical fistula due to additional colic he was suffered. Thus result the use of continuous bladder drainage in which involving catheter use. On the day of blood sample was taken for culture, the patient presented to the hospital with fecal urine in his CBD. S.maltophilia has a significant feature as its ability to form biofilms on surfaces, including glass, plastics, and host tissues. An infection was considered to be catheter related if there was inflammation at the catheter insertion site or if a culture of a catheter segment was positive for S.maltophilia. Thus, in this case, it is likely to say that the patient has been infected with the organism through clinical devices that were used during the procedures. Well, in this case, it came from the catheter of CBD. Furthermore, for the record, the patient's immune system had weakened in result of constant infection in his gastrointestinal and urinary tract, in which indicates that this patient had received antimicrobial therapy as in antibiotics within the prior onset of bacteremia. In short, this patient possessed multiple risk factors of S.maltophilia. As for this patient, he was received further antimicrobial therapy in order to fight against S.maltophilia infection that had invaded the sterile area of the body, which is blood. Once bacteremia was diagnosed, typically patients are likely treated with antibiotics. Patients that receive a proper antibiotic therapy have high chance of mortality rather than patients that did not bother about the antibiotic therapy given by intended physicians. It is crucial to identify the risk factors for S.maltophilia in order to prevent the transmission or treat the infection caused by this bacterium. And all underlying medical history assessment are need to be considered include previous antimicrobial dose therapy received, host immune status, identification of pathogen, and the ability of the pathogen to cause any further complications toward the host. Immunocompromised individuals are at a risk for infection of this bacterium, although in this case, the patient is not categorized as an immune-compromised patient, but he do have multiple systemic illnesses that made him susceptible towards microbial infection. S.maltophilia is rare to infect human as host. However, this organism tends to be co-colonizer for other prior infections. Okay, that's all from me. Thank you for listening and may you gain new knowledge through my case study. Thank you.